Okay. Thank you very much for the kind invitation to speak here today, and I will congratulate the organizing committee for setting up this very, very interesting program, and how phenomenal it is that we are actually able to meet. Let's hope that this will not be shown in the news media next week as a super spread event. That would be fairly ironic. So I will be talking about the impact of the COVID-19 pandemic on mental health and mental illness, with a focus on the conditions of the Danes during the pandemic. I should say that this is work funded by the Novo Nordisk Foundation. I got one of these really early grants during the pandemic, which was also a very sort of pandemic-like experience. A few days notice with the call, submission Friday, grant notice Sunday, that Sunday in the evening. So, and then we could begin. So maybe the foundations could learn something from that for the future. That would be that this could take 2 days and not 6 months. So, at the very early stage of the pandemic, this paper came out in JAMA Psychiatry by an American group. And when I read it, I basically thought that this does not only apply for suicides, it probably applies for mental health and illness in general, because mental health or mental illness is a poor mental health or mental illness is a key risk factor, or the most important risk factor for suicide. And if you look at these bullets here, illness and medical problems, check. Social isolation, check. Economic stress, check. Outcomes of national anxiety, that is the media coverage of a pandemic with daily reports on infections and deaths from all over the world, check. Barriers to mental health treatment, probably also check. It was some contacts to patients were transferred to video or phone calls, so they were probably not getting the same level of care as they were used to, even though the system here in Denmark did the best that they could. And I can also say that we have some survey data showing that the impression of the patients, of the accessibility of mental health, really resonates well with this. So they experienced what they perceived as less access to care. Decreased access to community and religious support, I think that's also a check. The firearms sales is basically an American phenomenon, but that's where these researchers come for. And I think this is really based on a misunderstanding. For as far as I know, you can't really shoot the virus, not even with an automatic rifle. So I don't know where that comes from. So this just goes to show that if you were to design a situation that would affect the mental health and pre-existing mental illness negatively, the pandemic is a pretty good cocktail for doing that. Therefore, there were a number of research groups across the globe trying to assess the mental health of various populations over the course of the pandemic. This is a PubMed search from today. COVID-19 and mental and survey almost 4,000 studies over the course of the 2 last years. Unfortunately, many of these studies are of relatively poor quality. There are a lot of cross-sectional studies, and many of them are based on snowball sampling. If you're not familiar with that, that would correspond to you receiving an invitation for a survey and being invited to send it throughout your social network. And in terms of being representative, that is associated with some quite obvious problems that are difficult to adjust for, because people do not choose their social networks randomly. If only they did, it would be less of a problem, but they don't. We in my group, we address this slightly differently, because here in Denmark we have the opportunities to do so. Specifically, we ran a longitudinal panel survey administered by the survey agency Opinion. And the advantage of doing that is that due to the information available on the respondents, we can apply weights to the results, and that renders the results quite representative of the Danish populations in terms of these characteristics. So it's not ideal, not at all, but it's better than much of the other data that is out there. So this was the main measurement that we took. This is the WH5, the World Health Organization Wellbeing Index, which is a quite well-validated tool, very simple tool for measuring the overall psychological well-being of people. It also turns out to be a relatively specific screener for depression. This score can yield this instrument yields a total score between 0 and 100. That is the sum of the questions multiplied by 4. If you have a score below 50, your risk of depression is substantial. It's a quite sensitive and specific screening tool that is used by general practitioners in Denmark as a first step assessment of people who might have depression. So we also included 6 questions on anxiety and depression-related symptoms on the scale showed at the bottom here. This is a very busy slide, but this is just to show that we did 4 rounds of this survey and have published 4 very brief papers on this. And the take-home messages are in the column to the right. The first round of the survey was really at the peak of the first wave of the pandemic here in Denmark, and we showed reduced psychological well-being compared to a 2016 benchmark. Again, not ideal, but at least we had a benchmark. Most other surveys actually didn't. And we found reduced psychological well-being in the general Danish population, and we found a quite clear correlation between the level of psychological well-being and the level of symptoms of anxiety and depression, at least indicating that it would be these symptoms driving the poor psychological well-being in the population. And I should say that correlation persisted throughout the 4 rounds of the survey. The second round was after the peak of the survey, where my interpretation of the situation is that people had sort of understood that we were not going to Italian standards in terms of the pandemic, and people felt slightly more calm. And we could see that in our data. We found increased psychological well-being compared to the first round of the survey, and comparable to the 2016 level, even a little bit higher, which also probably go to show that the first comparison was not completely off, even though the benchmark was from 2016. We went on with the third round of the survey. This was in late December last year. And we found, so this was when the second wave of the pandemic was going on, and we found that the psychological well-being was then back at the level of round 1. At our most recent survey in February, we compared the psychological well-being from round 2 of the survey to round 4, because round 2 represented the peak of psychological well-being in this data set, and we were sort of trying to look at the protracted effect of, or the effect of the protracted second wave of the pandemic. And we found that the drop in psychological well-being from round 2 to 4 was far most pronounced among young adults, which is also something that has been found in other countries. So to sum up, we found what appears to be a covariation between the pandemic pressure and the psychological well-being of the general Danish population. Pretty much what you would expect, in other words, and probably what you lot have felt as well, I would think. So, but from a sort of causal inference perspective, these data are far from ideal. It is very difficult to tease out whether this effect is a causal one, because there are many other things going on in the society, even though the pandemic is, of course, an immense impact on the people, on the life of everybody. So, but we have an opportunity to study this in further detail due to simply a chance, a kind of a natural experiment that occurred, because we included the WH5 tool in this study on runners and running-related injuries. A study that just by chance we were invited to. Would you like to include a survey instrument, a measurement in this particular study? And we said yes. So we have bi-weekly ratings on the WH5 from August 2019, when this study was initiated, until December 2020, meaning that we have pre-pandemic data on 7,800 runners from 78 different countries. The biggest contributors being the US, UK, Germany, Italy, and Denmark. So from a pandemic perspective, a quite interesting set of countries with some variance between them. And we will be looking at the association between COVID-19 related deaths per country as reported from Johns Hopkins University, and then the psychological impact of the pandemic adjusted for running and injuries, because you could assume that this is of course a very particular kind of group. Michael, could you raise your left hand? Yes, there you go. So that's a Garmin watch on Michael's wrist, and this is recruited via Garmin watches. So it's people like Michael contributing. And as you saw before, he's not representative of the general population. But you could argue that this is probably a quite resilient population if we are able to find what appears to be an effect of the pandemic on this particular population. It's probably true for the rest of the population as well, I would argue. This is work done by Helene Tilma Vistesen, and if that name sounds familiar, it's because they are familiar. She's working on these data, and I think I can reveal that it appears as if there is the expected association between the pandemic pressure and the psychological well-being also among these runners and across the countries in this particular sample. So now for another group that is probably more relevant to study than runners, namely those with pre-existing mental illness before the COVID-19 pandemic. So what I heard from my colleagues at the psychiatric hospital, especially here in Aarhus, was that in the beginning of the pandemic, there were quite a lot of patients having worsening of their symptoms, and that the relationship to the pandemic appeared to be sort of quite straightforward. They would report delusions concerning the pandemic. They would feel more depressed. They would feel more anxious, depending on their illness. So we got an approval to run a so-called quality improvement project. This is not a research study. This is something we did to inform clinical practice and to improve clinical practice. And that was to monitor these cases of COVID-19 related psychopathology or pandemic related psychopathology over the course of the pandemic. And these are data delivered by the Business Intelligence Office in Aarhus. There are quite they're up there on the second last row. Thank you for that. So we basically screened all clinical notes, text notes, on patients from February 1st to March 23rd last year. 412,000 clinical notes were screened for these corona-related words electronically, but then a manual step came in. We found 11,000 clinical notes containing one of these words. I had two younger colleagues screening these clinical notes manually for what this was of course a subjective interpretation. Did they contain pandemic-related psychopathology? Yes or no? That was the question. And we found almost 1,400 clinical notes describing pandemic-related psychiatric symptoms. Here is what that looks like in terms of the development of the pandemic. The green line is the number of confirmed cases of COVID-19 in Denmark. The black line is the number of clinical notes containing pandemic-related psychopathology, and the blue shows on how many patients these notes are distributed, because some of the patients had several notes reporting on pandemic-related psychopathology. And here's sort of the diagnostic distribution of these patients. These are predominantly patients with schizophrenia, with depression, and with reactive and adjustment disorders, sort of acute traumatic events. And in terms of the psychopathology in these clinical notes, they were predominantly anxiety, but virtually across the board, all of the symptoms that our patients have, we found examples of worsening that appeared to be related to the pandemic. So this goes to show that also among patients with among individuals with pre-existing mental illness, the pandemic has taken a hard hit, at least according to these data, which are also not ideal, because the reports in the electronic health records is of course very subjective, and we don't really have any data on the counterfactual. How would these patients do had there not been a pandemic? We don't have that. But this resonates really well with the clinical realm and the clinical reality that we have observed during the pandemic. So I believe in these data. What we did afterwards to sort of spare the mental health of the two students that screened the notes manually, because they were suffering after that the 2 weeks that they did that. So why not have a machine helping us? So we trained 2 machine learning models on these data, a classical division between a random subset used to train the algorithm and a test on the remaining 30%. I'm not a data scientist, but to some of you, these numbers will make sense. The highest obtained test, the best model, was the XGBoost with an area under the receiving operating curve of 0.89. So we used this algorithm to label the clinical notes from April till basically for a year, from April to April, and this is the blue line shows the sort of the estimated number of pandemic-related psychopathologies over time, and the gray curve represents the number of COVID-19 related deaths in Denmark. So there is a correlation, but there also appears to be this could be what Michael refers to as fatigue, but here in a good sense, that people are sort of habituation, saying they will not respond to this in the same manner negatively because they have seen the pandemic not getting out of control during the first wave. They are still alive, their relatives are still alive, the government handled the pandemic, so there's less need to worry, so to speak. That's how I see these data. We are now planning to run this algorithm continuously to monitor what may be left of the pandemic. This is just a final slide to show that I think in terms of the storm analogy, we are not really in the same boat in that storm. This is from the Financial Times, of course, referring to those with financial capital, but it also goes to people with this probably also applies to social capital, mental health capital, that those who are worse off to begin with are also worse off towards the end of the pandemic. And these are my acknowledgements. Thank you.